Sir, we are not able to hear you, sir. So we are not able to hear you, sir. Dr. Dhiren, sir, we are not audible. Dhirendra sir, you are not audible, sir. Please check your mic. Call करो ना. Sir, you are not audible. Dhirendra sir. Can you hear us?
श्रुति मैम बोल रही है so not audible. So you are not audible. See.
Hello.
Yes, sir. You are audible now.
Okay. Okay. So immune phases, which begins with renewed fever, headache, myalgia, and also this patient may have aseptic meningitis, which present like meningitis, headache, neck pain, and approximately half of the patient of this phase may develop this complication. And uveitis may be unilateral or bilateral, could be anterior, presenting with iritis, patient may have eye pain, congestion, or posterior uveitis, which can present with vision loss. Next slide. The third is the severe leptospirosis, also called Wills disease. So it may have pulmonary involvement, which present with pulmonary hemorrhages, which is one of the very dreaded complication. Patient present with hemoptysis, respiratory distress, nodular opacities on chest X-ray, and it very rapidly progresses to hemorrhagic ARDS, and which has a very high mortality. Second would be hepatic involvement, which is linked to ectohemorrhagica serogroup. And in G6PD deficient patient, even there is a risk of hemolysis leading to severe anemia. Patient usually have mild to moderate hepatic dysfunction with liver enzyme elevation and increased bilirubin. And patient may have renal involvement, which is one of the also common features, which can present with AKI and potassium wasting nephropathy in the form of non-oliguric AKI. May present with hematuria, dark urine, reduced urine output, edema, and many of the patient requires dialysis. But to a certain extent, this renal dysfunction is still reversible if properly treated on time. Or patient may have central nervous system manifestation like aseptic meningitis, meningoencephalitis, and very rare, even with hemiplegia, GBS, which is ongoing in Maharashtra, altered mental status, confusion, coma. Or patient may present with cardiovascular involvement in the form of low blood pressure, cold, clammy extremities, tachycardia, often due to dehydration, or they may have cardiovascular manifestation like palpitation, syncope, atrial fibrillation, various ECG abnormalities. Next slide. So ectric leptospirosis basically whenever there is a combination of jaundice, hemorrhage, and renal failure and pulmonary hemorrhage, then this is called Wills disease. So it is one of the very dreaded complication. Next slide. So case definition, I think already being covered by Semi Madam, so I would like to skip that. Next slide. So I'll just discuss two cases which we have encountered. This was a 36-year-old male faculty at KM Hospital, which came with fever with chill, jaundice, and breathlessness for one day. He had a history of high-risk exposure in the form of wading through the deep uh, flooded water. And on presentation, he has tachycardia. BP was almost normal. Saturation was 92%, which improves to 97% on giving 2 liters. And patient had ictus. On RS examination, patient has bilateral vessel clefts and also right hypochondric tenderness, indicating a hepatomegaly. Another systemic examination was with it normally. Next slide, please. So investigation-wise, patient had low platelet count, 36,000, total value of 5.1. SGOT, SGPT enzymes were raised, BUN of 56 and raised creatinine. And his rapid diagnostic test with lepto IgM was positive. So the clinical impression was leptospirosis with thrombocytopenia with hepatorenal involvement. Also, systemic inflammatory response with acute lung injury. So patient was immediately started on injection crystalline penicillin 20 lakhs IV 6 hourly for 7 days along with supportive therapy. And he was off oxygen by day 4 and lab parameters normalized by day 6 and he was discharged on day 7. Next case. Next slide. So this was the second case. It was a 27-year-old female which was 8 months pregnant, presented with a history of fever with chills for 2 to 3 days, generalized weakness. And on presentation in our institute, uh, pulse was 140, tachycardia was there, and systolic BP of just 60 millimeter of mercury. RR was very high, patient has tachypnea. Saturation was initially 98% on room air, and she has bilateral extensive clefts. And during the course in the EMS itself, patient developed severe respiratory distress and hemoptysis. So patient was immediately intubated. So the ET tube of the patient has hemorrhagic secretions, so indicating a hemorrhagic ARDS. So patient was immediately shifted to MICU. Next slide. So this is the X-ray of the patient where you can see that there are bilateral fluffy fasciitis in the all the lung feeds. So this indicates a alveolar hemorrhage in the lungs. So patient was immediately put on invasive ventilation with 100% FiO2. Required inotropic support. Patient underwent cardiac failure and there was a cardiac arrest which was revived after 2 cycles of CPCR. Again, patient has persistent hypotension, tachycardia, and almost comatose. Next slide. So, in spite of repeated efforts, patient couldn't survive. When you see the lab reports, her platelets are normal, slight leukocytosis is there, and initial rapid diagnostic tests were negative. X-ray shows bilateral homogeneous opacity, suggestive of ARDS, and the lepto-PCR report came later on after 3 days of death. And so diagnoses were acute pulmonary hemorrhagic ARDS due to leptospirosis. Here notable feature are that there is no hepatorenal involvement and no thrombocytopenia, but very high mortality because of hemorrhagic ARDS. Next slide. So this is our data basically in 2020 1-year data where we have noted that there were 197 cases of leptospirosis over 1 year, and the maximum number of cases were clustered during the month of July, August, which is your monsoon month. Next slide. So this is our MISU data for 6 months from June to November 2023, where we have almost 36 cases of severe leptospirosis, and the mortality was very high, almost 55.6%. When you compare the mortality with other diseases like dengue and malaria, this is considerably very higher. Maybe the primary reason may be hemorrhagic ARDS and multi-organ dysfunction. Next slide. So these are the various differential diagnoses. Common differential diagnosis, especially during monsoon season, would be falciparum malaria, which can have similar features of fever, chills, and can cause cerebral malaria also. Can be easily differentiated based on the serology or peripheral smear. Then dengue fever is another very common mimic, which can have similar features. So patient have fever, severe myalgia, bleeding tendencies, patient have thrombocytopenia, and serology can diagnose the dengue fever. Another disease which can be confused with this is scrub typhus. So this is more common in rural areas. Patient have fever with rash, including on the face, HR at the site of sugar bite, and regional lymphadenopathy. So hematological will show leukocytosis, thrombocytopenia. There is only mild elevation of LFT, and serology can diagnose this case. This is very important because one of the drug which is been used for leptospirosis, like doxycycline, would be effective against both lepto and scrub typhus, whereas the other drug cannot be effective against scrub typhus. Next slide. So typhoid fever is another differential, having high-grade fever, rose spots, diarrhea. Again, the serology and blood culture can detect the bacilli. Another differential would be viral hepatitis, especially if the patient has fever and jaundice. Also, viral hepatitis doesn't have renal and pulmonary involvement. And their AST or liver enzyme elevation is very high compared to your leptospirosis, and serologic and diagnostic. Then another differential would be if the patient have altered sensorium meningitis, very rare. Next slide. So pathogenesis is basically in asymptomatic or mild leptospirosis, which is 90% of the cases. Patient have initial rise of inflammatory markers, but there are anti-inflammatory molecules in the body which counter that inflammatory response, and there is a clearance of leptospira from the body, and that's why the patient doesn't have major symptoms or organ involvement. Whereas in severe leptospirosis, patient has delayed and sustained immunological response, the immune phase basically. So they have delayed rise of inflammatory markers like interleukin 6, human necrosis factor alpha. So your anti-inflammatory response of the patient is overburdened by this pro-inflammatory state because of the severe infection. Next slide. So these are the various physiopathological changes. So major thing which happens is whenever leptospira enters the body, it is usually encountered by macrophages, which lyse the bacilli, and because of the lysis, there is a release of glycoprotein from the outer membrane. So this glycoprotein has a tendency to inhibit sodium potassium ATPase enzyme, which is one of the very common enzyme which maintains the osmolarity of the cell. So that leads to changes in various tissues like muscle, which cause potassium depletion, myocyte necrosis. Then heart, there may be myocarditis, arrhythmia. In liver, there may be hepatic dysfunction, jaundice. In kidney, there may be tubular dysfunction, potassium excretion defect, then acute kidney injury. In brain, there may be headache, altered level of consciousness, convulsion. In digestive system, there may be vomiting, then electrolyte disturbances. In lung, there is alveolar edema. So all this is related to basically inhibition of sodium potassium ATPase. It's one of the very common target for glycoprotein of the bacterium. Next slide. So now last part of the presentation is management basically. So mild disease we can manage with oral tablets like doxycycline. Adult 100 milligram orally twice daily for 7 days. Children can be given 2 milligram per kg per day, two equally divided doses, not to exceed 200 milligram daily for 7 days. So these are all international guidelines. Then azithromycin, adults 500 milligram orally once daily for 3 days, or children 10 milligram per kg orally on day 1, maximum 500 milligram, followed by 5 milligram per kg per day once daily for another 2 days. For pregnant female, azithromycin can be used 500 milligram once daily for 3 days, or amoxicillin or ampicillin can be used 25 milligram to 50 milligram per kg in 3 equally divided doses, maximum being 500 milligram per day for 7 days. Whereas in severe cases, adults, penicillin can be used 1.5 million units intravenously every 6 hours, or doxycycline IV can be used 100 milligram IV twice daily, or ceftriaxone 1 to 2 gram IV once daily, or cefotaxime 1 gram every 6 hours for 7 days. In pediatric population, again penicillin can be used 250,000 to 4 lakh units per kg per day in 4 to 6 equally divided doses. Maximum dose which can be used is 6 to 12 million units. Another drug which can be used is doxycycline 4 milligram per kg IV per day in 2 equally divided doses. Maximum dose will be 200 milligram per day. Or ceftriaxone 80 to 100 milligram per kg once daily. Maximum dose between 2 gram per day. Or cefotaxime 100 to 150 milligram per kg IV per day in 3 to 4 equally divided doses. For pregnant women, again penicillin, ceftriaxone, cefotaxime, or azithromycin can be used in the above dosages. Next slide. So these are the as per the Government of India guidelines. So what would be the first step, initial step in PHC level? So first of all, case definition. Patient should be suspected, and initial prophylactic treatment can be given with administration for adult doxycycline 100 milligram twice daily for 7 days. For pregnant and lactating mothers, as per these guidelines, ampicillin 500 milligram every 6 hourly, or amoxicillin can be used. Then children under 8 years, amoxicillin or ampicillin 30 to 50 milligram per kg per day in divided doses for 7 days. And third step would be rapid diagnostic test, which would be confirmed later on with ELISA. And patient should be referred to higher center whenever patient show features of severe infection in the form of hypotension, decreased urine output, hemoptysis or breathlessness, or bleeding tendency, or they show features of aseptic meningitis like altered consciousness. Next slide. So what would be the treatment step at community health center or district hospital? So same clinical suspicion, treatment protocol is similar. Laboratory screening, additional tests can be done like CBC, liver function test, kidney function test, and referral should be done whenever there is a renal complication like oliguria, less than 400 ml per day, elevated BUN, creatinine, then jaundice with serum bilirubin more than 3, pulmonary symptoms with breathlessness, hemoptysis, or chest X-ray showing opacities, or if the patient shows neurological features like meningoencephalitis, or there is a bleeding issues, spontaneous bleeding or low platelet count. Next slide. So at the tertiary level, one or two steps are similar, but a treatment protocol like for adult 100 milligram twice daily doxycycline, crystalline penicillin can be used 15 lakhs IV intravenously every 6 hours. In cases of penicillin hypersensitivity, alternatives like ceftriaxone 1 gram. Actually, this should be IV every 24 hourly for 7 days. Then cefotaxime 1 gram IV every 6 hourly for 7 days. Or even erythromycin can be used 500 milligram IV every 6 hours for 7 days. For pregnant and lactating mothers, ampicillin 500 milligram every 6 hours. And children under 8 years, amoxicillin, ampicillin 30 to 50 milligram per kg per day for 7 days. And in severe cases, crystalline penicillin can be used 2 to 4 lakhs international dose per kg per day. Next slide. So what are the other supportive roles? So whenever patient has renal failure, there is a role of hemodialysis as a part of supportive therapy. Then for shock, inotropic support can be used provided the CVP is raised. Then hemoperfusion can be used for severe ARDS cases. It's a form of hemodialysis. Then for secondary vasculitis, then corticosteroid has been propagated by some of the studies, but there is no definite randomized control studies that to recommend that corticosteroids are indicated. But some of the condition where corticosteroid can be used is like severe hemorrhagic ARDS, vasculitis, or severe thrombocytopenia. Then there are role of fresh frozen plasma, cryoprecipitate if there is a feature of disseminated intravascular coagulation. IVIG has been tried in some of the severe leptospirosis cases like ARDS or severe thrombocytopenia. But again, there are case reports, so there is no definite recommendation for that. Platelet transfusion can be given if there is a severe thrombocytopenia like less than 10,000, or if there is a thrombocytopenia and patient has bleeding, irrespective of the platelet count, or if the patient have hemorrhagic ARDS with thrombocytopenia. So these are the few conditions where you can use platelet transfusion. Next slide. Okay, thank you so much.
Thank you so much, sir, for the elaborate presentation on the clinical aspects of the leptospirosis. So there are some questions in the chat box. You may please reply on the chat while we have the other presentation going on. And if at the end there are even unanswered questions, we can take one by one after all the sessions has completed. Thank you so much, sir, for this wonderful presentation. So now we move on to the next presenter, the experts, Dr. Jyoti Ravne, ma'am. So ma'am is the professor and head department of microbiology, Government Medical College and Hospital, Chhatrapati Sambhajinagar, Aurangabad, Maharashtra. So as already mentioned about the ma'am's various accolades, ma'am is the expert on the AMR and One Health, not only nationally but also at international level with the WHO Technical Expert Committee. And ma'am is guiding all of us in these aspects of One Health, especially in the laboratory diagnostic part. So over to you, ma'am.
Yes. Good afternoon, everybody. First of all, I wish to thank NCDC, the One Health Zoonoses Division, the JIPAGO team, special mention to Dr. Simi Tiwari for giving me this opportunity to talk about leptospirosis. So I would straight away begin with the very difficult aspect of diagnosing leptospirosis. The main objective here would be to give an overview of all the diagnostic tests that are available. Of course, we understand that most of the time the clinician will initiate the treatment and management, which is recommended also because of the limitations of culturing and growing leptospirosis. But then we have the benefit of direct diagnostic tests, but of course the cumbersome and the high-end infrastructure that is required, plus now the availability of PCR across everywhere can be a boon to support the clinicians with the diagnosis. Next, please. So we are aware about the large number of species of Leptospira which are available, and they have been categorized as pathogen, intermediate pathogens, and environmental pathogens. And this classification is primarily based on the 16S ribosomal nucleic acid sequencing. And we understand that we have a few of these types which are affecting the humans primarily, and they are more pathogenic. In all this modality of diagnosis, we have only MAT, which is the one which gives us the classification of the serovars. But we need to understand that as I mentioned earlier, that the treatment is initiated, but diagnosis needs to be made finally to confirm the case and also to understand what are the organs that are affected and what are the complications that can be. And of course, finally, we also need to have it on the epidemiological parameters, because that actually helps to plan the key interventions in specific areas. Next, please. So we have a case here in our own hospital where the patient presented with fever, high grade, but intermittent for 4 days with headache, muscle pain, and jaundice. And other manifestations were mild abdominal pain, vomiting, and drowsiness. No other positive manifestation, only the presence of jaundice and the symptoms which I have described. This female worker was a laborer in a farm and was managing the cattle and crops. And she of course gave the history of walking in the fields without footwear, no travel history, but yes, direct contact with stagnant water in the fields, the animal urine and mud during the agricultural activities was asked and mentioned by the patient. There was jaundice observed, there were no rashes, and the urine was dark colored. So next, please. The various investigations, yeah. Next, please. Yes. So various investigations were done, and I'm just summing up the investigations. There was a decreased CBC count. There was severe thrombocytopenia, elevated liver function tests, especially SGT, SGPT, alkaline phosphatase. INR was also raised. Renal functions were elevated. There was hepatomegaly. Activated thromboplastine time also was found to be decreased. And yes, we had non-reactive all HIV, all the viruses. Dengue was also non-reactive, but IgM ELISA tested positive for leptospirosis. Next, please. So we categorize or we define the methods for diagnosis for leptospirosis. Mainly first the direct methods, where we go for the direct dark field microscopy, which can be done on blood and urine. Second would be we isolate the leptospira by culture, which of course takes time. Then third rapid method, which would fall under the direct methods, would be detection of the genomic DNA by molecular methods. And finally, the very convenient, doable, and available, very easily available, is the detection of antibodies by the serological tests, such as the microscopic agglutination test and the rapid test. Next, please. So these are the most important aspect for diagnosing any infectious disease, for that matter, is collecting the right sample, transporting it in the right way, and processing it. So as far as leptospirosis is concerned, we would mainly bank upon blood as the primary sample, urine, again a very important sample, and it would be tissue and CSF based upon what would be the organs that are involved, and we can go for collection of those two samples. So mainly blood and urine for a case, the one like which I described just now. Next, please. So this table practically gives us a very clear idea about which sample needs to be collected. So when we are talking about blood, we would have the serum sample or the whole blood. So when it comes to serum, only in the early phase, that is up to 10 days, and again in the convalescent phase, that is 2 to 4 weeks after the onset, this test, this sample would be very effective, because we will be either showing a demonstration of high levels of antibodies using the MAT test or ELISA, Or secondly, we would be showing a fourfold rise in the titer for other tests. So that would be after 2 to 4 weeks. Now, when it comes to the whole blood, this again is very useful for a direct active infection through PCR. We can do this in the initial phases of the illness, or we can also identify Leptospira DNA in the bloodstream. So the whole blood will be basically collected best in the acute phase within the first 7 to 10 days of the symptoms. The next important sample is urine. So after the first week of illness, we need to collect the urine. This can be then collected up to 30 days also. Here we have to understand that bacteria are shed intermittently. So on the urine, we can have all the tests that can be done. We can do PCR directly on the to detect the Leptospira DNA, but we can also go for the culture. CSF again, early collection in cases with severe neurological involvement when it is there. So here PCR will be done to confirm the presence of Leptospira in the CSF if there is a suspected case. The tissue samples again here, it would be mainly for the diseased cases where we would want to look for presence of Leptospira in the tissues when we want to rule out the diagnosis and want to confirm the presence of Leptospirosis. Here histopathology and PCR can be done on the tissue samples. Next, please. So by microscopy, we will use the dark field microscope. We understand dark field microscope will be used because of the size, the slenderness, and we are able to detect the very characteristic motility of Leptospira. And as I mentioned, the four body fluids like blood, serum, urine, and CSF can be used. The sample, it has to be actually centrifuged before looking for the presence of Leptospira. And if the sample is collected in blood, then an initial spinning would be required to remove the blood cells. Now, this is again an important step which could be missed. So this particular component, when the blood is collected in a sodium oxalate or heparin treated blood. Next is doing the fluorescent antibody staining technique and the hybridization technique using the Leptospira specific DNA probes are found to be very effective, useful, and this can be directly done on the clinical samples again. Next, please. So in the dark ground microscopy, this particular test actually requires a large number of organisms to be present per ml. That is 10,000 to 20,000 organisms per ml are required. So therefore, this test that way would be very, limited, has a limited sensitivity of around 40% and specificity of 61%. Again, there can be a confusion with the fibrin strands and the erythrocyte membranes that can be confused. Now, again, another limitation is the sporadic shedding, by which we may report it as a false negative. Motility can be hampered sometimes, especially after the immune stage has been reached, where the reactive antibodies would hamper the motility of these pathogens. So we say that it's again very cumbersome and very tricky to catch this sample. So it is not recommended for routine diagnosis, but yes, it can be very well used for confirmation of cultures where we are growing the Leptospira, and DGM can be useful there. Next, please. Culture. So this is a definitive method for diagnosis, again using the same samples, that is blood, CSF, urine, or tissues. So here different culture media are available. So we have the ones which are actually semi-solid in nature. We have the Fletcher's or Stewart's medium where the rabbit serum is used, or in some media we can even use the bovine serum sample can be used. Now here, once we take the blood directly, we are going to add into this medium a few drops of this medium, a few drops of the blood into this medium. For urine, it is very important that we take dilutions of the urine sample. Very important component is that it has to be collected and inoculated very soon, within 2 hours, because the acidity of the urine may damage the spirochetes. So the dilution says 1 or 2 drops of the undiluted urine and 1:10 dilution of the urine are to be added in the 5 ml of the medium. Now, these culture media which are available, they need to have a lot of antibiotics that need to be actually added. We have vancomycin, polymyxin, bacitracin, all these can be used. Besides this, we need to add 200 microgram per ml of the 5-fluorouracil, because this will then help to prevent the contamination by other bacteria. Next, please. Another very commercially available, very useful medium is the EMGH medium or the Fletcher's medium, which is Ellingoson's McGlaw-Johnson-Harris medium. Again, this also has 5-fluorouracil added to it. Now, as I mentioned, when we are doing the urine inoculation, we need to go for dilutions. Same needs to be done when you are using a tissue. This tissue needs to be macerated first aseptically, and then you go for the dilutions of 1:1, 1:10, and 1:100. Now, very specific features are needed or incubation conditions are needed for leptospirosis. The temperature is either room temperature or 30 degrees Celsius in the dark, and it has to be kept up to 6 to 8 weeks before declaring it as negative. So ideally, you examine the culture on the first day, third day, and fifth day, followed by the 7th or 10th day interval, and do this up to 6 weeks. Now, you look for the presence of growth. This is to be done because you have to pick a sample right from this culture media a few centimeters below the surface of the broth culture, because the organisms have a tendency to grow below the surface. So once you pick the growth, you look for the presence of the typical motility under the dark ground illumination. So the classical corkscrew motility is the very typical for thinking that, actually mentioning that it is a positive case. Next, please. So what is the ideal time for culture? For blood, it will be within the first 10 days of symptoms, and for urine, which I already mentioned, 10 to 30 days after the onset of disease. And for CSF, when there is a neurological involvement and presentation is going towards the neurological involvement, 5 to 10 days after the onset of the disease. Next, please. So what are the various advantages and disadvantages? We are all very well aware that it is confirmatory. The big advantage of actually having the serovar typing, you can actually have the epidemiological component of what is available, what serovars are present in that region, and then these serovars, when you can culture, you can use it in the MAT test also. Other important benefit is the kits and the vaccines both can be manufactured for that particular region based upon the prevalence of that serovar. Disadvantages: labor intensive, it is slow growing, there is a high risk of contamination, and inability to isolate due to antibiotic administration, which is the most common limitation that we have, the microbiologists usually face, that the culture facilities could be developed and available, but then you have much faster, better methods like the molecular methods, which can actually help in treatment management. But yes, of course, the epidemiological and the very big advantage of understanding the serovars and being able to have the epidemiological parameter would be a great idea for culturing. Next, please. Then the polymerase chain reaction, the benefits of PCRs, we are very well aware now. The facility being available at practically every district hospital in the country after the COVID pandemic is a boon. And these test kits can be employed where PCR is very rapid, sensitive and specific right in the first few days. So once we have epidemiology about prevalence of leptospira in a region, the PCR kit can be really very useful for helping the clinicians. So the sample again, the blood, urine and CSF. The confirmation, we can couple up PCR with antibody demonstration by doing the serology. So we have a confirmed case per se. Disadvantages: require specialized equipment and is susceptible to contamination. Of course, this is, again, we can say that now availability of the instruments is there, but there is always a limitation of availability of validated kits in the market, because presently at most places it is a multiplex PCR which is available under the banner of maybe tropical fever or with some other pathogens. So we can use, and again, coupling it up with serology can be helpful. Then it has a limitation of having false negative results due to inhibitors which can be present in the clinical samples directly. Next, please. Other molecular methods, they are highly complex and labor intensive, but yes, they can be useful for for reference laboratories for understanding the different serovars. So here the PFG, that is pulse field gel electrophoresis, and restricted fragment length polymorphism can be useful. Then sequencing, of course, can help to identify Leptospira directly, and especially this can be useful when the bacterial load is very, very high. So it can be useful in severe disease before seroconversion occurs. And we look for various genes, that is 32 kilodalton lipoprotein, that is LipL32 gene, 16S or 23S ribosomal RNA, or the insertion sequence 1533 can be looked for. Next, please. So serology, I must say it is a microbiologist friendly investigation. Easy to do, has its own advantages, but yes, we can look for serology, especially for leptospirosis, especially if there is a fourfold or a greater rise in the titer of the agglutinating antibodies. Indirect hemagglutination, not very commonly used, more replaced by rapid immunochromatography assays and ELISAs. Next, please. So ELISA, we have the advantage of having IgM and IgG separately. So IgM antibodies appear within 1 week of illness, and they will reach the peak up to 3 to 4 weeks, and then they will decline. IgG antibodies appear later. So IgM ELISA can be very useful. So in the case that I mentioned to you, we were able to detect this case as Leptospira positive with the IgM ELISA. So it is very easy to perform ELISA. All laboratorians will understand that. Once it is set, it becomes very, very easy. More easier than doing a MAT test, especially useful in the early infection. But advantages is the disadvantages, it will not give you the specific serovar type, which MAT can have the advantage of giving. And another disadvantage, like any other serological test, could be cross-reactivity with other diseases. Next, please. So this is just a principle of ELISA. Different types of ELISAs are available. So we can either have, we can do the ELISA again on the culture growth or directly from the patient specimen. And we have the principle where we use the microtiter plates, and we look for the reading is to be measured by looking for the OD values on the spectrophotometer, that is the ELISA reader that is available. Next, please. Rapid tests, we have wide array of rapid tests that are available now, which are based on simple latex agglutination tests, or there are dipstick tests which are available. But most of the time they'll give the quick results, but always it's always better to have a confirmation with MAT. The results are available within minutes to up to 2 hours with minimal processing, straightforward interpretation, and it requires minimal facilities. The advantages of rapid tests being innumerable, with stability of the reagents also. And yes, of course, but confirmation and again validation of these rapid tests is a big thing which the work is in progress, where the validation process of all these kits would be done. So we have either a lateral flow or a flow through or an agglutination test. And the only limitation again being the cross reactivity and variable sensitivity and specificity, especially if the kit is not validated at the right pattern. Next, please. So the gold standard, we must say, the reference test, that is microscopic agglutination test, acronymed as MAT. This test involves the patient's serum is mixed with a microtiter in a microtiter plate with the live antigen suspension of the various serovars. And this is to be incubated for up to 2 to 4 hours at 30 degrees Celsius. And then you look for the dark ground look for the presence of motile Leptospira under the dark ground microscope. Look for the presence of agglutination under the dark ground microscope. And again here, the fourfold increase or even a single titer increase more than 1 in 200 is considered to be positive. So this will again involve what are the serovars present in that geographical area, and the kit can be standardized using those serovars so that we catch on all the cases which are available in that region. Next, please. So this is again a pictorial representation of the agglutination. Again, this is also performed in the microtiter plate. The big disadvantage is again that you have to first grow the leptospira. That means you are going to use the live suspension of the organism, which again is the limitation unless the lab is trained and tuned to isolating leptospira. And of course, then this can be standardized and validated by having this advantage of looking for the agglutination reaction. Next, please. So what are the interpretation and applications of the MAT? So it cannot distinguish between acute, recent or past infections. Two serum samples are ideally required 2 to 3 weeks apart, which will indicate active infection through a seroconversion or a fold rise. Cutoff titers will vary. So as I mentioned previously that the geographical area would define what would be the CRORs and plus what is the cutoff titer that can be used. This again could have limitations of false negatives and cross reactivity is a component that can hamper. Undoubtedly, the specificity of this test is very, very high because we are using the live organisms here. Disadvantage, as I mentioned earlier, the limitation of using live leptospira cultures and may yield false negative if the causative strain is missing from the antigen panel. Next, please. So standardization issues are also very important components that can happen leading to variability in the results. So therefore, it is recommended to test the pair serum samples together for consistent analysis. In epidemiology, it has applications that it can actually identify the various serowars or serogroups, and the residual antibodies from the past infections may then actually complicate the seroepidemiological findings that we get with the other serological tests. Next, please. Yes, so this is something new that is, I mean, I will not say new, the component or the concept is available since quite some time, but this can be applied for rapid diagnostic tests for leptospira. This is use of biosensors, which they operate through the probe hybridization. So these combine with the biorecognition elements with transducers for rapid detection. So it's mainly the cell wall component of these leptospira, the LPS, which is present, would be utilized for preparation of the probes so that they can be detected easily. And these biosensors have come into market as various tests where 3 target amplicons can be detected. That is a lamp target, the internal control and the chromatography control. And this particular DNA biosensor is able to detect even very low quantity of the DNA when it is present. Next, please. Now, these were the specific laboratory tests that are done in the microbiology department. And here we have a list of tests which I mentioned in my case also, which help the clinician to get a holistic diagnostic panel per se, which will involve CVC, which will involve kidney and the muscle markers, where you see the elevated creatinine kinase, high blood urea, the high bilirubin levels, alkaline phosphatase. There is in the urine also, there will be proteinuria, leukocytosis, CSF analysis when done, and finally adjuncting it with the serum testing for looking for high titers or a paired serum. Next, please. So the summary for this particular diagnostic approaches towards leptospira diagnosis, we will categorize them as we can say that there could be direct detection, which will include microscopy and molecular detection. There could be culture, that is an indirect detection, or there could be also immunological detection, where we can look for we can make use for the MAT test, and then of course the ELISA and the latex-based test. The microscopy would involve dark field microscopy, immunofluorescence, then silver impregnation methods also are useful for whole of the group of the spirochetes that includes leptospira also. And molecular detection, we talked about the benefits of PCR. Culture and immunological detection. Culture would of course take time and 6 to 8 weeks. Immunological detection, again, you can make use of these tests after 10 days. and MAT or ELISAs or lattice-based agglutination tests can be used. Next, please. Thank you.
Thank you so much, ma'am. With the elaborate demonstration and presentation about the laboratory diagnosis. So with your presentation, a lot of questions are coming up. People have more advanced requirements to understand the details. So please answer the questions in the chat box. Meanwhile, we go for the next presentation with the taking the One Health approach in consideration, the role of the veterinary in leptospirosis control, diagnosis and management. So we have with us the esteemed speaker, Dr. V. Balmurugan sir. Sir is a principal scientist, veterinary microbiology at the renowned institute, that is the National Institute for Veterinary Epidemiology, Disease Informatics, Nivedi, Bengaluru, which is the WOHA, that is the World Organization of Animal Health Reference Laboratory for the leptospirosis, and sir is heading the activities and research there. So over to you, sir.
Thank you, Dr. Jitesh. Am I audible?
Yes, sir. Please go ahead, sir.
Okay. So, respected dignitaries of NCDCs and expert and participants, good afternoon to everyone. At the outset, I take this opportunity to thank the NCDC, especially Dr. Simi Tiwari Madam, to given an opportunity for sharing our laboratory experience of leptospirosis to the different participants and different stakeholders. So my topic will be the presence of presentation on animal leptospirosis. That is why we required animal leptospirosis, and it is played a much role in the control of the disease, especially the diagnosis and the spread of the disease, how to control and prevention measures. So my topic will be initially about the disease. People ask to a lot of question. I have seen the diagnosis. So unless understanding the pathogenesis of the disease and spread and the nature of the infection, stage of infection, it is very difficult to diagnose of the disease. What Dr. Jyoti Madam is presented, very complicated and very tricky to diagnose the disease cases. So I will be presenting my presentation overview of initial about leptospirosis, then I will go to the animal leptospirosis importance, then it will be going to the diagnostic aspect of animal leptospirosis, as well as epidemiology of leptospirosis in the environment and animals. So this will help you to identify the disease, control the disease in One Health aspects. So next slide, please. So these are my outline of presentation. There most of the people know that different names starting from very severe form of disease, wild disease and waterborne and rat fever, mud fever and 7 days fever common in our country. So next one, please. So this is the fastest re-emerging diseases. That's why we are discussing and debating in the One Health aspect of disease in zoonotic aspect. It is emerging important public health problem. It is caused by the pathogenic leptospira and neglected disease, undiagnosed zoonotic diseases. It affects both human as well as the animals. Variety of mammals it will be affected. It causes significant economic loss to the animal farming community, and it is because this leptospira have adapted to the environment and great diversity and ability to infect and survive in the wide range of animal host. So generally incident host, human or domestic animal, carrier host, animals again, reservoir hosts, again rodent and mammals in the forest. So as we discussed earlier, India is endemic, that is the state's coastal area. Please next slide. This is the leptospira, how it look like spirochetes in the laboratory. I think most of the people undergone training in our laboratory, more than 6 batches or 7 batches we covered so far. So each batch consists of 25 to 30 people. So 200 manpower expert we have created from our lab from this under the NCDC program of intersectoral coordination as well as National One Health Program for prevention of control diseases. So it is a very thin and a long 0.1 micron, that is 6 to 20 micron shape. It is a flagellate, actively mobile organism. So there are more than 64 species of Leptospira, comprising 30 serogroups and more than 300 serovars. So it is very difficult to diagnose the infection with this number of organisms. Please, next slide, please. So this is the genomic classification. Now we are more focusing on the pathogenic species of Leptospira, that is 17 species, as well as intermediate species Leptospirosis pira. That is when there is a conducive nature, this intermediate species become pathogenic. So we not much worried about the non-pathogen of 26 species of Serovar, more than 60 Serovars in this group. Please, next one. So if you are seeing the serological classification, there are 30 serogroup. All the serovars, 300 serovars are placed under this group. So maybe the each serogroup containing the specific serogroup name. Please click on the next one. So you'll be getting the name of the serogroup, serovar. So you have to understand that there is a virulence changes where there are there is an outbreak of Leptospira in human in Arabian Sea part. That's why it is from Kerala, Karnataka, and Maharashtra and Gujarat. It is very severe compared to the Bay of Bengal part, Chennai, Orissa, and West Bengal. It was there is a lot of debates are going on there. So we are working on that to identify any virulence factor or adaptation of this serovar present in the environment play a major role. Or some of the severe outbreak happened in Mumbai 2015. There are Dijasmin serovar play a major role, cause a more fulminary form of disease than other form before incubation period of 15 days or 10 days. Next one, please. Yeah, you can see that different serovar placed in different serogroup. That is why that even one serovar may be representing the one serogroup or more serovar in one group. But during the diagnosis process, we should employ each serovar to detect any specific antibody. That's why the Dr. Madam told we are to include this is a live antigen based microscopic agglutination test. So we have to include any number of common prevalent serovar to be employed in the panel. So our animal Leptospira surveillance or epidemiology will help you to find out the different prevalence of serovar in different geographical area, so that we can employ that particular serovar in your microscopic agglutination test. It will vary from Gujarat to Kerala, or it is in the West Bengal to Chennai. So even though there are common 12 serovar we are employing for the diagnosis of disease at present, and most of the lab they are using only few serovar instead of 12 serovar application in the laboratory. Next one, please. Next one. Yeah, you can see this is a very filterable organisms. So it can pass through 0.22. So while culture maintenance, if you are facing any problem in contaminated with other bacteria in the lab, you are feeling. So if you see very pure culture of Leptospira in our lab, so you can see the background, there is no noise of other bacteria. So if you are feeling in any contamination, risk of contamination in the laboratory, you can filter that. Again, we can grow that one with filter purification method, as well as additional of serum for growth of the organism. Please, you should be differentiate from Treponema, Borrelia, and Leptospira. So I will come back to that. Please, next one. So you can see the difference. Treponema you want to do in the laboratory identification, you can take the morning smear of your teeth, and you can observe that non-pathogenic Treponema. So you can easily expose to the system how to differentiate spiral organism from the with the hook, that is Leptospira, or other organism is spirochetes only without hook, and it will be movement. Second is again next please. So you can grow the organism. It is gram negative and it has both the structure of gram positive as well as gram negative. So people who are culturing in the laboratory has to be aware of the growth pattern of the leptospira. It is aerobic but micro aerobic. So it will grow under the surface of, that is with 95% oxygen load and able to locomotive in nature, and also it required carbon source for the long as a long chain fatty acid. So we are using the media, that is why twin 80 in the media for the growth of the organism. It is highly susceptible to sodium chloride. So it will come in the spiral form, it become the spherical form if you are treating with the sodium chloride and some of the detergents, hypochlorite and highly sensitive temperature. Please, next slide. So you can see the dingus ring, that was the below surface aerophilic. So while subculturing the leptospira in the laboratory, you have to subculture below the surface to pick up the organism. So you can see the pleasure or motility of other bacteria compared to leptospira. Please going on, click that. So it is other flagellar nature. Please, yeah. So you can see the engine with the propeller in aeroplane. So this is the propeller mechanism in movement of the leptospira spirocheta organism. Please, next one. So this is the structure of leptospira spiral organism. So that hooks, how it is projecting and piercing the tissues, that will cause the damage of the tissues, especially in the lung. If you are doing pulmonary, so it will cause lot of hemorrhages. So it is difficult to save the patient. Otherwise, most of the case end with the organ failure. Please, next one. So I was showing this slide for better understanding of leptospira pathogenesis, how it is severe when it is affected or a patient are having the infection. Next one, please. Yeah, this is the different type of flagellar or periplasmic flagellum in leptospira, endoplasmic. So A, B, C, D, and E. There are so many types of endoflagellus are there. Please click next one. So you can see the jet engine in aeroplane. So you may be having the that is the force they are showing the flagella B type of flagella. Please click next one. Yeah, you can see again, click. Yeah, you see again, click, please. Yeah, you see the rotation because of that pressure. So that much property, that leptospira migration, very, very important while understanding the pathogenesis of the disease. Please. So when compared to this one is endemic nature in the coastal, as Dr. Simitivari madam is told that it is spreading to non-endemic, that is other part of the country also apart from the coastal area. So we are getting the more number of cases from animal as well as the human also, because it is wherever expert is present, leptospira will be present. So whenever you are establishing the lab, you will be able to detect the pathogen. Please, next one. Yeah, now it is spreading like all over the country. Please, so it is data is lacking actually. So next one, please. Yeah. So here with respect to epidemiology, there are four reservoir for leptospira identified in India. That is Bandigota bengalens and Rattus intern and Bandigota indica and Rattus rufescens. So they are field rat and house rat as well as sewage water. Bandigoats are played a major role in reservoir of leptospira in the country, apart from all the animals are suffering from leptospira as a carrier animal. Please, a prolonged leptospiruria is the typical case of carrier animal. Please, next one. Yeah, this is the risk factor associated with the leptospira. So physician has to aware of the disease and where the patient are exposing to the infection. So they may be having the occupational group of farmers or associated with animals, history of travel, history of recreational activities of human, household environment like presence of dog, domestic livestock and rodent infestation. So all to be considered, because these are the high risk group of populations or different stakeholder. starting from farmers to civil emergency personnel. So they are associated with the horse or dog. So adventure travelers and agriculture workers, very important, and the presence of their activities, like they are working in the farm without wearing the gloves or a bare hand or bare legs. They are working in that in the field of sugarcane field or rice field, etc. Please, next one. So this is the other factors, those who are associated with workers, apart from worker, taking the bath in common area and outdoor environmental condition, poor sanitation measures, animal rearing practices, both places, rodent density. Next one. So waterlogging plays are very important. Please, next one. Yeah. So you can see that one. Even we have habituate of drinking the gomutra for the religious purpose as well as spiritual reason, and bathing in contaminated waters and buffalo wallowing. So rat pestation. These are all the risk factor or susceptible factor to individuals. So even we can new house ceremony, we are doing the puja with gomutra. Nowadays, they are giving sterilized gomutra is distributed for the puja after making the awareness of the program. And rodent, wildlife, small mammals are generally reservoir. Animals are incidental host or carrier host. Incidental host, animal can take infection from reservoir host, and human can take the infection from carrier host as well as from the reservoir host contaminated water. Please, next one. So it is difficult to eliminate from the environment. So the control measures mainly depend on the tropical region where we are living that. So it is plenty of rainfall associated with us. So it is often difficult to avoid the exposure of the people to the animal or in contaminated environment. So bacteria is well adapted to the environment. So control measures generally it depends upon the protective measures and awareness program and preventive measures. We have to follow that, or prophylactic doses. Please, next one. This is the transmission cycles involve animal, human, and environment. And here you can see the rodent, a single drop of urine. So it containing millions of around is 100 millions of leptospira per ml of urine. Similarly, 1 million of urine leptospira in 1 ml of urine of cattle, and even other swine, dog, and even equine, that is it is associated with UITs. And most of the animal leptospirosis is associated with the reproductive related issues, because there is a persistence in the infection in reproductive tract as well as the carrier status in the kidney tubules. Adaptation of the leptospira in environment as a biofilm also reported recently with other microorganisms. So it is danger for the future because we have only one drug of choice for leptospirosis treatment at present for prophylactics or as well as the treatment. So we have to think over that what is the need of other drugs in requirement in future, because sometimes the persistent of infection or resistant to the present drug may lead to future. There is a lot of complication, and so it is a big challenge for the scientific community to develop the drugs. So there are three types of leptospirosis area. One is urban leptospirosis, rural leptospirosis, and wild animal leptospirosis. So the circulation is kidney colonization and environmental biofilm formation. For the survival of the leptospira outside, it is environmental biofilm, and the inside it is a kidney colonization. So it is evasion from the immune cells. So it is continuously secreting the organism through urine. So contaminated urine is the source of infection to human. Please, next one. So it is a public health significance because we have in the country large livestock, rodent, wild population, poor sanitation condition, poor animal health practice, close association of animal and human being, and providing all this environmental congenital spread of the infection for the diseases. Next one. So again, this is the activity. So major Leptospirosis reservoir responsible, as I told you, there are a number of 10 importance one, starting from icterohemorrhagia, orzo, and astralis. These are the common reservoir we are employing in the diagnostic laboratory to identify of the human cases. Please, next one. So we might have seen in news so many cases of leptospira during the monsoon season. Why it is so? Because of it is common endemic problems. Okay, you know, as the human Dr. Jitendra Yadav sir told, complication of clinical diseases and pathogenesis, how to manage the clinical management apart from the diagnosis. So this is very important. So we have to be alert for every monsoon, pre-monsoon season, and to make proprietary drugs, prophylactic drug for doxycycline in Kerala every time they are following, and Gujarat also to some extent. So human leptospirosis, there is a typical form, atypical form, and non-specific form already discussed by the Dr. Jitendra Yadav sir. So I will skip this slide. Please, next one. So in animal, you see the same. I was discussed that except the dog, other animal leptospirosis or carrier status, dog is similar to human cases. So it is acute cases will happen in only in dog, and very rarely in case of horse UIT's cases. So other animals are common carrier of infection, and it is associated with reproductive problem. Next one. So these are the common reservoir prevalent. In case of leptospira in environment as well as in the host, there are two type of infection. One is maintenance reservoir, the animal which is having the infection. It is infective reservoir. So some of the animal will maintain some reservoir for in environment. Example, cattle for orzo, sheep and goat for pomona, or pig is pomona and tarasovai. Horse is canine is for canicola and icterohemorrhagia. These are the common reservoir maintained by the particular species of animal. They may get a chance of getting infection from other animal also, that is infective reservoir. By using the microscopic aggregation test, we can identify the what was the recent infection caused with the reservoir. That's why we have identified during Mumbai outbreak 2015, the jasmine is the infective reservoir in the particular locality, even though other prevalent reservoir present in base level. Please, next one. Generally, the immunity also it will vary with according to the reservoir infection and host factor major role. In case of bovine leptospirosis, you can call it as bovine genital leptospirosis. So it is a persistent infection, as I told you earlier. It can happen in that is reproductive organs. So it is causing the infection and reproductive problems. So abortion will be there, and productive and major farming losses, economic losses for new birth, all it will be associated with the animal production system. And case of kidney, continuous maintenance of leptospira and secretion through urine and make the contaminated environment for the human being associated with the animals. So generally it is infected by pathogenic reservoir, and it is a potential carrier. Cattle are the potential carrier, can shed around millions of leptospira per day. So in bovine farm, cattle, cows is the indicator whether cows are the afterbirth, cows are moving from one place to other place and spread the infection, and infection will be detected in cows in acute cases in some time. So that is the indicator, so that cow will show the much jaundic type of symptom in the bovine farm. Please, next one. So these are the different symptoms. We have shared the slides, so you can go through the participant to understanding the disease. And generally, abortion will happen with high fever and causes 4 to 7 month age group of gestation. So generally, out of 9-month gestation period, so we can suspect it. And blood tinged milk also, because the leptospira associated with more affinity towards the endothelium of blood vessels, so there will be the damage. So we can expect the blood tinged milk and hematuria And apart from the jaundice, other things you can observe in the young calves. Please, next one. So these are the common risk factors. So you can ask the history from the patient. They are associated with all these factors in the form, as well as we can diagnose the disease by physician taking the history of the patient. Please, next one. So it is similar to the swine leptospirosis. Most of the northeastern part of the country, they are associated with rearing of pigs for their livelihood. So they are also very cautious in getting the more cases nowadays from Assam. And we are working on northeast area to identify the serovar. There was not much data available in animals leptospirosis apart from the environment. So we are working on that. We found that some of the specific serovar can be implemented in particular states. Please, next one. So this is the clinical case. Reproductive clinical signs is major. These are the major serovars play a role, and generally subclinical infection in animals. And as I discussed earlier, it will be persist in kidney as well as in genital tract. Please, next one. So we also in investigating the some of the outbreak in the field with animals as well as environment and human cases associated workers. So we are collecting in the sample in One Health perspectives, and we are doing the different type of tests starting from microscopic aggregation test, PCR isolation, and we could be able to do the isolation from the environment as well as from the aborted fetus placenta. So it is clearly indicating that to prove that abortion due to leptospirosis, we have to prove that animal, that young one also having the infection. Otherwise, in animal abortion due to, so organism is plenty of organism is associated with abortifacients and especially the brucellosis and trichomoniasis and campylobacteriasis. So these are associated with abortion. So whenever we are doing the investigation for the abortion, so we will be including the leptospirosis also one of the component in that. Please, next one. So in canine, it is a typical form that Stuttgart disease in Germany. It is very similar form of disease in man. So chronic in leptospirosis as well as acute cases, typical fever, jaundice, vomiting. Even though animal are vaccinated with 4-5 serovar, there are chances of getting other serovar infection because some of the serovar are not cross protective antibodies because protective antibody is serogroup specific. So it may not have the complete protection. The animal has to be vaccinated repeatedly for maintaining the immunity status till the infection is subsided. And every year vaccination to avoid the colonization of the bacteria in the kidney so that the animal will be healthy and is not possible to secrete the organism from the urine side. Please, next one. So this is again a different form, ecteric form and ecteric form. It is biphasic fever is the common in dog. So we will be observing that jaundice form of the infection or vascular symptom and other kidney related biochemical parameter will help you to identify the cases in dog. Please, next one. So different serovar may give the different infection or different severity infection, or as well as based on the immunity of the host all play. But very risky is the pulmonary form of the disease. It is very less known in the case of canine, but in pulmonary form very detailed studied in case of the human side. Please, next one. So these are the risk factors associated with the canine leptospirosis. So you have to see that the patient is from associated with dog rearing or pet maintenance animal, regularly vaccinating. So all the history will help you to identify the case at an early stage. The major issue in leptospira is early detection case is very, very important to implement the treatment and subsequently prevention and control. So early diagnosis miss, then it is difficult. Patient will go to the organ failure and complicated diseases. Please, next one. So this is the challenges in animal leptospirosis. What we are facing is I was discussed that colonization and the outside environmental and kidney colonization. How to diagnose the disease using the chronic cases of animal, because always MAT it will give the base level, because what madam was told, it is 1:100, 1:50. It is depend upon the location specific where the disease is endemic. So 1 in 20 or 1 in 50 with the leptospirosis, a titer of MAT, it is always in endemic will be there. So we have to rule out whether it is increasing the titer or the patient is suffering or their patient is normal with the titer, because once a constant exposure in the environment, it will give the positivity of the MAT. So we are, as per our endemic state, 1 in 100 for the animal and 1 in 25 to 50 for the human being, the fixed titer. After that, it will be second sample has to be checked to identify the infective serovar titers. So the patient which is having a infective titer serovar above 1 in 200 is clearly declared with one sample. It is positive for leptospira. No need of other requirement test. So directly can be gone for specific treatment for the doxycycline, one course of antibiotics treatment. So please next one. So these are the work human associated with laboratory workers, abattoir workers. They are exposed to different type of organs in the field and in the laboratory. So they have to use protective environmental requirement, that is PPPE. We have in the laboratory has to be practiced, and it is BSL2 organism. So level 2. So it is no need of worried about that aerosol spread. So even animal experiment of leptospira organism, BSL2, it's required. BSL2 type of. Please next one. So you can see the picture. It is a picture of animal leptospirosis for the different species. You can see that the data is very less of the animal, but bovine it is covered in entire country, canine somehow, sheep and goat in different part, wildlife, all the things we have to study. Swine, some reports are only available because they are wherever animals are there, there are chances of getting the leptospirosis infection. Please next one. So these are the different serovar distributed in different geographical locations. So we will be selecting as a referral lab. We are informing to the state laboratory to follow this type of serovar to be employed in your particular diagnostic laboratory in human side. That's why we are playing the major role to control of the disease instead of diagnostic and treatment. Diagnosis is very, very important. Also, we are providing the referral cases diagnosis at the earliest possible time to save the patient. Please, next one. So it is a northeast region. So different region have different serovar and different distribution of serovar in different regions, especially in Andaman in different and northeast different and southern part of country. So generally all the animal has the serovar, but the percentage distribution and survival of the environment, it is varying. Now we are studying the environmental surveillance to collect the sample from the environment, what is the play role and how it is adapting to the different host. And we are started studying from this year. We have got the genomic project from National One Health Mission from ICMR. So that will help you to further understanding of the disease virulence from the environment and maintenance in the animal and the human host. Please next one. So this is the different pattern in Andaman ecosystem. So there is the different pathogen emergency. Every 5 years we have to assess the prevalence of serovar. Any emergency serovar is coming or existing serovar disappearing. So the intermediate serovar become pathogenic. All it will tell about the prevalence study when you are doing with the animals. Please next one. So we are also associated with an NIMANS for neuroleptospirosis study. So we helped them and sample are collected from different patient coming to the hospital for the disease infection. We found that around 28% positivity of leptospira infection with the CSF sample. Please next one. So this again, we are studying the human cases with few cases in one location, that is Dakshin Kannada. Karnataka last 2 years study we have done. So different distribution of the PU cases, and we have identified the different zeros. And please next one. So we found that around 20% positive in ELISA, but 40% positive in case of microscopic recognition test. Specificity is very, very less. Around 1,600 sample we have screened. ELISA is positive for 350 samples. Next one, we have found out the hotspot also in that region. So overall positivity in case of MAT, it is 44. I told you that is specific test, but ELISA sometime it is sensitive, even though sensitivity it is false positive, as well as it is giving a cross reactivity with other infections. So none of the ELISA tests available in as present in the commercial format. It is not highly specific, and it may mislead. So that we have included the PCR along with the ELISA is the confirmative test, or any detection of antigen antibody along with the detection of antigen. It will be the confirmative test, or eye detection of titer with MAT. It is a confirmative. Please next one. So mostly it is a young population, that is 20 to 40 age group, that is adult group. More field workers are highly prone for the PU cases infection because of their occupational activities. These are the different sera in different taluk in particular endemic areas. So when you are giving the panel to particular district laboratory, we have to consider all the panel, and which is the sample which is positive by picking up. So that sera should be included in the panel. So it is a mixture of panel is necessary to pick up even a single sample. That panel has to be decided in the laboratory. So we are helping the state laboratory or district laboratory to incorporate this type of sera, and we are ready to provide the sera to establish the microscopic agglutination test laboratory as well as in particular state. Please next one. So again, environmental surveillance, we want to know really what is happening apart from the animal in the field. So we collected most of the 40% of sample, environmental sample as pathogenic Leptospira. You can imagine it, Lippel 32 based PCR we are able to detect from sewage water, nearby household and surveillance and ecological places. And we also isolated the organism from the environment. We are now in the process of complete whole genome sequencing. Please next one. So this is the isolate. You can see that when collected from the field with the help of a medical doctor, that from Dakshin Kannada, and the backyard of particular household where patient died due to Leptospira, we collected. This was the positive cases. So there is constant exposure of where patient human being with backyard environmental condition. So we observed that. Please next one. So biosafety, most of you know that it is biosafety level 2 is required. It is level 2 categories organism as per Department of DBT biotechnology level requirement. It is common protective PPE material is required to handling the organism. These are the common disinfectant used to destroy the organism in the laboratory as well as in the environment. Please next one. So coming to the diagnosis, there are different stages that was discussed by the Dr. Jyoti Madam. There is a different level and different stage the organism will be there. You can see, and different test has to be employed. So there is a big challenges in the diagnosis. So employment of the correct diagnostics and employment of using of sample and stage of infection and interpretation of the result, all is very, very important in diagnosis of it, because it is complicated with other mimic symptom diseases, and also it is neglected, so it is difficult to trace back. So now we have alerted, included in the pyrexia of unknown cases by initial screening by ELISA, further confirmation by specific test like RT-PCR or microscopic agglutination test. So you can see the difference, incubation period in leptospiremia phase and spiruria phase. So initially 10 days organism will be there in the blood, and after 10 days organism will be in the urine. So the patient come to the testing, they will come after 4-5 days of fever, other thing, then another normal drug, they will take 3 days for normal antibiotic therapy. Yeah, then it will reach the 10 days. So the correct sample we are not getting in the laboratory for diagnosis of infection. So most of the case we are missing as a negative in the bloodstream, but detecting in the urine as a chronic infection, and some cases with the identification of high titer of serum titer in blood sample after 10 days. Next one, please. So this is the challenge we have that leptospiremia phases 7 days. There are the different type of test can be employed. MAT with second sample is required if low titer of disease. Otherwise, if negative, it will be zero. We cannot declare that. Again, we required a sample to confirm the by PCR or the other test. After 10 days, for leptospiruria stage, so you can apply that. So even though array of laboratory tests are available, so it is very difficult to diagnose leptospira in human and animal, because selection of right specimen, as I told you, during the stage of infection, and application of the correct test in the laboratory and correct interpretation of the result also very important from the laboratory. Most of the laboratory, they may not aware of that how to interpret the MAC positive cases, ELISA positive cases. ELISA for IgM ELISA cases example 9 to 11, it is a doubtful sample. People, they are getting 8 and they are declaring is negative. So it is not a negative, the patient is in early stage. And next day sample tested, the patient is positive. So that's why we made the awareness program during our training. So we trained more than 200 people. Now most of the lab, they are aware of how to interpret the result of ELISA, just saying instead of negative and positive. So otherwise we can request the next sample from the patient in next 2 days. So that will give the clear confidence that your diagnosis system is working well, and identify the case at the earlier stage so that the treatment can be employed. That is our objective, is to identify the case, treatment, and control the disease. That was the major goal of this entire project and program. Please, next one. So this is the chart which is there in during 2001. It is different stage and what are the tests can be applied. What is interpretation has to be done. Please click, going on click. So this is to see test can be applied. This rapid test only, please back. Yeah. So rapid test can be applied in the initial stage. Isolation can be done. So after during treatment, we cannot go for isolation. It is very difficult to isolate the organism from the human. Best isolation procedure is from a rodent, and it is very easy because rodent are not susceptible host. It is reservoir host. So identifying the isolate from the rodent, it will tell you the prevalence of particular serovar in that particular region. So that serovar local isolate can be employed in the laboratory to diagnose the disease with high sensitivity of MAT. So MAT is having generally inherent properties, low sensitivity, high specificity. To increase the specificity, sensitivity of the MAT, we can include the local serovar. That will help you to identify the case at the earlier stage. That was, we are working on that. It is similar to the cattle, canine, similar type of the stage, different test has to be applied. Please, next one. Next, please. So these are the different tests available. We are doing in our laboratory, microscopic agglutination test. You can see, go back, no problem. It is, I will discuss one by one test. Yeah, it is dark field microscope. We are supplying the cultures to different lab under the project, and silver staining method. Those who are not having the dark field microscope, we are also selling the kit for this one silver staining technique. This is the electron microscopic. If required for new isolate identify, we are confirming by whole genome sequencing and structure everything. Generally, you can see the motility of leptospira. It is flexion and extension, alternative rotation, and translation. These three activities should be there. In microscope, you cannot show the same field or same location you are identify as a leptospira to the others. So that means you are able to identify the leptospira. It won't be available at the same location or same time. So that is the clear indication of leptospira identification in the dark field microscope methodology. Please, next one. So you see the difference other organism. In the blood picture, you may not see like that laboratory cultures. You will be seeing the one or few structure, but you can confirm that because sensitivity very less in dark field microscope examination, a minimum organism you required 1 lakh, that is 10 to the 5 organism. If it is there in the blood, you can able to detect the organism in the serum. So serum sample will be good source. We can see in the or plasma, we can observe that leptospira. So otherwise it is a fibrine nature. If it is organism is not able to move, it is present in the same location. And moreover, it may not observe like culture leptospira, but here sluggish movement of leptospira spirochetes will be there. So you cannot write leptospira by seeing the dark field microscope. You can write spirochetes like organism is observed. It may be leptospira. Because you may not know the what is exactly, so the diagnosis also we can give by dark field microscope examination. And because sluggish movement will be there because a patient already taken the antibiotics, so that's why it is difficult to isolate and difficult to observe in the dark field microscope cases. This next one, yeah. Can you click the video there? One more arrow will be there. Yeah. Yeah, you see, this is the dark field microscopic. I want to show to the participant how it look like leptospira, how it is multiplying. It is very rarely taken the video to the flexion, extension, and translation, movement, and dividing also. You can see that one. It is the 40 objectives, different objective, how it look like. So you see, this is the double one in the flexion and bifurcation 2. Translocation, transversion division. It is not by binary fission. So you can see the one by leptospira become 2 by the translation. So that's why we want to show that. And it is 100x. Actually, we required for 100x condenser, 100x condenser, dark field condenser required. You have to place the oil both the side. This is that, then only you can able to see the leptospira. That is very important. Generally, we'll put 100x only one on the top of the oil. We have to put the oil below the condenser as well as over the slide also. This is the 100x. So you can see the different multiplication of the organism. I would like want to show to the participant. So this is the rotation, flexion, and extension. All will be there. So that is a typical property of the endoflagella motility. So it will go from one place to another place. So I think you are observed the leptospira. Most of them what undergoing training in our lab, they may be very well observed about the leptospirosis causing the pathogenic leptospira. So these are the scanning electron microscope pictures. Generally, we'll do for the new isolate when we are isolating. Please, next one. So these are the serovar we are maintaining out of 29 serovar. Some of the serovar we are panel we are gone under proficiency testing by international forum, Netherlands, and we are also maintaining the reference serum for proficiency test. Now, as per NCDC request, we are making the panel of serum. The proficiency test will be providing to the participating laboratory for whether you are correct in identifying the cases for microscopy elimination test, etc. Please, next one. So we are having the different hyperimmune serum from different serovars, and we'll be providing for the proficiency test or any reference sample, any other requirement. Please, next one as a referral. So here we have already done endemic is 1 in 100 dilution of MAT. So here we are using 1 in around 100 million bacteria, 10 to the power of 8. 100 million, that is 100 million bacteria we are using for the detecting the reactivity, that is in MAT. So if it is a strong reactive, serum is having the antibodies, so it will like reaction will go. So clumping of the bacteria will be happened. So it is microscopic agglutination test positive. So high titer, which titer is the matter? So above 1 in 200, it is clear cut indication of positivity, that is patient is exposed to pathogenic leptospira recently. Please, next one. So this is the isolation. You can see the dingus ring, that is the bacteria will grow in the semi-solid media, EMJH media will have the dingus ring. So this is the identity of the culture. Other bacteria is not there, no contamination. So we can use this culture for the microscopic agglutination test. Please, next one. So commonly we'll be using the pan biokit for detection of antibodies in a human sample initially, and then subsequently we'll go for microscopic agglutination test. Please, next one. In bovine case, we have the only Orzo ELISA kit. We are not recommending because India is not only having the Orzo serovar, but other serovar is prevalent. So it is no waste using the bovine leptospirosis ELISA kit for screening purpose. The kit is meant in the USA. So we are not recommending that kit for using in the animal people. So here PCR, we are using only LPL32 based PCR, the common and most commonly used for both animal and human, as well as WHO recommendation and OR recommendation. Please, next one. So we'll doing in the real-time PCR format. Other PCR we are doing for the characterization and typing of organism in the laboratory. Please, next one. So we are also working on the developing of the spot test. Most of the request I asked, rapid test is working. So we are working on the recombinant antigen based rapid test in the field requirement. And initially we are worked on bovine samples. We succeed in screening of sample at the penside level because the local laboratory, they can similarly we are working for canine as well as a human. We'll come up with some good latest agglutination test so that primary health center can identify the case at the earlier that level. If it is positive, he has to reconfirm with other test in the laboratory. If it is negative, it is negative for PPR because that negative predictive value of our test is more than 96-97%. So you have to correlate with the clinical sign of the patient. And we have used this beads in some of the field also to along with the microscopic agglutination test in confirmed leptospira patient with the PCR. So we are able to detect the antibody in the animal. So this will soon will come into the evaluation stage with the human sample with the human reference laboratory in collaboration mode. Please, next one. So we have a technology in our laboratory. We released for the bovine lepto kit and we got patent for that also. Please, next one. So these are the different tests. What is the merit and description? What is the procedure you can use? How to interpret the disease? That is very important based on the sample because sample is our patient in the laboratory people. So we have to analyze the sample in a proper way so that it will give the fruitful result to the physician to diagnose the disease. Please, next one. So challenges I already discussed. So we are also developing the ELISA for animal diagnosis for reproductive problem because persistency in the kidney, there was very difficult to identify the case because some of the protein is not expressed in the normal acute cases. So expressed in kidney persistent stage, that protein we are targeting by transcriptomics analysis and subsequent expressing the cloning and developing the diagnostic. That will help you in the ELISA. Please, next one. So treatment for the animal, we are human. Human, they already discussed by Dr. Sir. And then animal, we are generally using for tetracycline or oxytetracycline for acute cases and chronic cases, long-term standing oxytetracycline. Please, next one. So control generally in animal, we have the vaccines for the dog as well as cattle as well as swine. So there are multiple serovar vaccines, 4 to 5. That is depend on, again, I told you it is depend on the location. So commonly they will use this vaccine in order to avoid the colony that is kidney persistence. So you can avoid, and also colonization in the reproductive problem. So you can avoid the farming community losses. That is the major objective of this. Please, next one. So prevention, I told you that there is difficult to eliminate. So you have to go for protective measures and preventive measures. So multiple pathogen involvement, different serovars prevalent in different region. Avoid difficult to expose people to different environment. So clinical diagnosis is not clear. So all this we putting in the big challenges for us. Please, next one. So environmental measures is the biggest way to control this disease. These are the number of protocols. This is a common protocol we have to follow and employment in the regular activity. Please, next. So control and prevention in One Health aspect is very, very important disease because a good model for involvement of all the sector, and it will easy for control of the disease, starting from veterinary doctors, human and specialist. Please click, going on is click. So you see, this is the good model environment specialist, how to maintain the environment, and we can make the Leptospirosis specifically to alkaline soil, it will be persist. So you want to make to alkaline soil, so we can change it to acidic soil, so susceptibility will be less. So all these medical, veterinary and environmental scientists, municipal council, sanitary department, wildlife department, all will be very much required in to control these diseases. That's why we want to emphasize in that. Please, next one. So we have a lot of challenges in this One Health management of the leptospirosis. So solution we have given below that for each challenges. So it can be achievable in coming years with more awareness program and more involvement of manpower and stakeholder involvement and stakeholder training, and then subsequently prevention and control measures implementation. Please, next one. Yeah, these are the facilities. We have all the required facilities for diagnosis of leptospirosis in human as well as animal available in our laboratory as a referral laboratory. Please, next one. Yeah, these are the material. You can scan and take the material by QR code. So we have the different languages and veterinary manuals and epidemiological risk factor survey sample to be submitted to our laboratory. Everything is available in online. Please, next one. Yeah, thank you a lot for patient listening. I hope I am ready to answer for any query from the chat, or better to interact with me through this one. I take this opportunity to thank you the support of NCDC for the last 5 years from intersectoral coordination. So we are happy to help the country through One Health approach to that. Thank you so much.
Thank you so much, sir, for this elaborate and excellent presentation. So we are seeing the number of applause and the appreciation from the participants because of this such elaborate and with the interactive presentation and with newer aspects to the motility of the spirochetes and how it looks into the microscopy. So you got the many requests for the hands-on training, sir, for the many participants. And we are proud to have Nivedi as a partner with NCDC and Center for One Health for the One Health programs. So we are like happy to collaborate with sir. So thank you so much. Thank you all. So most of the questions are answered by the experts in the chat also, and as well as during the presentation of Balmurugan sir, most of the queries are also answered that we have seen the questions. So maximum questions have been answered. So considering the time and participants are there, so we will be sharing the presentation already shared in the chat box. So maybe referred by the participants in the link also. So thank you so much. I take this opportunity to again thank our all the esteemed experts, Dr. Dhirendra Yadav sir, Dr. Jyoti ma'am, and Dr. Balmurugan sir, and Dr. Simiti Tiwari for their excellent presentations and enlightenment on the important topic of the leptospirosis. On behalf of NCDC, DGHS, MOHFW, I request, I thank all of you. And thank all the participants for staying along with us with this extended presentation. Thank you so much.
Thank you so much. Thank you, one and all.
Thank you. Thank you, everyone.